All right. Hi, Western Maryland, and welcome to this joint event seminar from the Maryland Department of Aging, and I'm with the Maryland Insurance Administration. And we're here today because Medicare Open Enrollment is coming up, and it's important that you know where to go to get your questions answered and what that means. What does it mean that Medicare Open Enrollment is starting on October 15th? And then I'll be here to talk to you a little bit about how not to be a victim, how to protect yourself from insurance fraud. Today, my name is Patricia Dorn with the Maryland Insurance Administration, and we have Rebecca Bradley, and she's with the Maryland Department of Aging. We also have 4 SHIP representatives today with us from Allegheny, Frederick, Garrett, and Washington County. And this is going to be approximately 35 minutes long. So we're going to answer some questions like what is SHIP and what is Medicare Open Enrollment? Where can I get my Medicare questions answered? And how can I protect myself from insurance fraud? All attendees of this event are currently muted. If you have questions while we're speaking, please put those in the chat window. There could be 2 potential windows that you see, chat and another one that says Q&A. Please use the one that says chat. We will have a question and answer session at the end when we're all done speaking, where if you prefer not to type your question, then you can unmute your phone and ask us questions. And with that, I'm gonna hand it off to Rebecca.
Good morning, everyone. Can you advance the slide? So thank you for joining us. I'm from the State Health Insurance Assistance Program, and there are some other coordinators on the line who are also from the different counties in Western Maryland. And so the State Health Insurance Assistance Program is a national program that provides information and assistance to Medicare beneficiaries for to help them understand their health benefits. And so it's a national program, but there is a SHIP office in every county in Maryland. And so we want you to be able to connect with those in your county. Next slide. So we want to give you a few tips for open enrollment. And so for the Medicare annual open enrollment period, it is from October 15th through December the 7th. This is a national deadline that CMS has put out there, this time period. And this is a period that people can make changes. And why you can make changes is because the plans in the state across the country have already made decisions about what changes they want to make to their plans. And some of the changes that they've made may include how much they're going to charge you for your premium, or what coverage they're going to charge, or how much you're going to pay for co-payments. They could also be changes in what areas they want to provide services in. So they may have been providing services in an area and they decided, oh no, we're not going to provide services in that area anymore. So it's not just up to the plans to make decisions, it's also up to Medicare beneficiaries to make decisions about what works for them. And so everyone should have received their annual plan notice to change letter. And that's something from the plan if you're already in a plan. If you are not in a plan, this is an opportunity for you to figure out what plan you might want to be in. And so depending on what plan you're in, that letter looks very different. Sometimes it's just a booklet. Sometimes it's a letter telling you how the changes impact you. Sometimes there's several pages that talk about what the changes are for you in the upcoming year. And so we want you to look over that. If you don't understand that, you can always call your SHIP office and they can help you in kind of understanding the information there about what's going on with your plan in the upcoming year. And there may be no changes in the upcoming year. And then we want to think about what is important to you, what matters to you. And for everyone, it looks very different. For some people, they may say, you know what, I have a limited income and it's very important for me to find a plan that's in a particular income range or cost range. This is how much money I need to spend. And that could be for their premiums, that could be for their medical appointments, whatever it is that's important for an individual. For some people, they're saying that, you know, I have limited income, but I think I can manage my money. But what's important to me is that I can go to the provider that I want to go to. And so with this counseling, it's an opportunity for you to figure out if the plan that you're in is going to continue to provide or include your providers in their network. And that's very important for a lot of people. The next thing is, and this is not what a lot of people call for, but our SHIP offices always try to assist with that. And that's to help you understand if you qualify for any of the assistance programs that are available to actually help you with paying for your Medicare costs. And so there are some that can help you with the premiums. There are some plans that can help you with your co-payments, particularly with prescriptions. And so when you meet with your SHIP counselor, they're going to help you kind of figure out, based on your individual circumstances, what your income is, what your plan is. Are there some things that you can do to help you with those costs? And then the other thing is like shop for plans. And with all that information, it's an opportunity for you to look at the different plans that are available in your area and figure out what is the best plan that meets your needs. And so, and it says meet your needs and fit your budget, and they definitely go in together. And so one thing I want to warn you is that the SHIP office is not going to tell you this is the plan that you should enroll in. They're going to tell you that based on what you said is important to you, here are some of your options. And if you said cost is important, they may tell you these are the three least expensive options for you. If you say, I want one that has this particular provider in the network, but these are the plans that have this particular provider in the network. And they're not going to say that this is the plan you should take, because it's really an individual decision. And one thing that I like about our SHIPs is that they're not going to push you to select a particular plan. So what they'll do is say, you know, if you need to think about it, you can think about it. If you want to talk it over with a loved one, you can talk it over. If you want to go to your provider, you can go to your provider. And so you have this period of time to do that. And so the costs for our services are at no charge. They are unbiased. So our coordinators do not get any commission off of enrolling you. So they don't have a personal investment. They just want to be able to assist you the best way that they can. Next slide. And then here are the numbers for the different counties in Western Maryland that you can contact a SHIP counselor. And so it's very important that you contact your SHIP and schedule an appointment. For most of the offices, they are looking at scheduling appointments to be able to accommodate you. And I want to say that you do not have to call your local SHIP office. You can also call 1-800-Medicare if that's better for you. Have to warn you, they can give you some general information very similar to SHIP, but they don't necessarily know about the state programs if you're looking for some assistance in helping you with some of the costs. And so if that's the assistant you're looking for, then you might want to contact the local SHIP office in your county. Next slide.
All right, thanks, Rebecca. Again, I'm Patricia Dorn. I'm with the Maryland Insurance Administration. And before I get started, just one thing, there were a few people that came on while Rebecca was talking, and I just want you to know that this event is being recorded. So thanks. I'm with the Maryland Insurance Administration, and what we are is we're the state agency that makes sure that the insurance companies in Maryland follow laws, and we're the state agency that makes sure that those agents and brokers, that those people that sell you insurance follow the laws as well. And so, like it says here on the first line, license the insurers, and we license the insurance producers, those agents and brokers. So this being Medicare Open Enrollment time, you might be interacting with an insurance agent. And you should know that if you want to file a complaint against an insurance agent, you have a place to go, the Maryland Insurance Administration. If you want to check and see if somebody's licensed to sell the insurance that they're telling you that they can sell, you can contact us as well. And then if you have a complaint against an insurance company or an insurance agent at any time, the Maryland Insurance Administration is the folks that you can contact. I'm going to just get going. So what is insurance fraud? I'm just going to talk to you about insurance fraud for a few minutes. And that is, that's when somebody, it could be an insurance agent, or it could be just a consumer. It can be anybody. It's when somebody commits a deliberate deception for financial gain. Insurance fraud is one of the most costly crimes in our country, and it costs about $40 billion per year nationally, which is a crazy amount of money. According to the Coalition on Insurance Fraud, it's estimated that each household in the United States pays $1,000 extra in insurance premiums each year to offset the costs of insurance fraud. And so seniors are often targets of insurance fraud, and especially with regards to life and health insurance. And so with the life insurance, that can be going on year round. You know, you may have people contacting you. Just be careful. With the health insurance with seniors, this is the time it's going to ramp up because it's Medicare Open Enrollment. So please be wary of salesperson, a telephone caller who contacts you unsolicited. So somebody who calls you without you asking them to call you, they've probably obtained your information through a mailing list. Don't feel obligated to talk to that person. Be careful if they use high pressure tactics. So high pressure tactics don't really belong in this world of selling insurance. They shouldn't be treated like a last chance deal or a fire sale. That can be a little, with regards to most insurance policies that you buy, we can say, hey, take your time, definitely. You should always do that. Because Medicare Open Enrollment is a limited period of time, it is only 7 weeks long, approximately. It can feel urgent, and it can be easier to fall for a salesperson who is telling you that this is a last chance deal. Be careful anyway. Take your time. Don't wait until December 7th to start looking if you want to switch a Medicare Advantage plan or you want to get a new Medicare Part D plan. Definitely be careful. Don't wait until the last minute, and don't fall for the last chance. Be careful if they want you to pay cash or make a check out directly to him or her, so directly to the agent. Never pay with cash, and always request a receipt. Be careful if somebody wants you to sign forms that are false or incomplete or blank. So please don't sign forms when somebody tells you, I'll fill that out for you later. That's a scary thing, and you definitely don't want to do that. Make sure that you read and make sure that you understand the forms that you sign. And if you are unsure whether or not the insurance makes sense to you, and you don't think that you can come to the conclusion on your own, I mean, the first step is read through the documents, ask the questions, see if you can understand it. If you can't, you can reach out to friends and family who might know more about it. You can reach out to the SHIPs. You can reach out to us at the Maryland Insurance Administration. Talk to somebody else who can help you understand the insurance policy. If you have we don't all have accountants, attorneys, and financial advisors in our lives, but if you are somebody who is lucky enough to have those people, you can reach out to them for assistance as well. And so no matter what, slow down and take your time. Be careful if the price seems too good to be true. If this can be more so true with something like an auto insurance policy. If you know that normally you're paying $80 a month, $100 a month for auto insurance, for example, and suddenly there's a policy for $25, those are reasons to say, slow down and find out a little bit more about this. Contact the Maryland Insurance Administration and make sure that it's a legitimate insurance product. Again, pay by check or credit card. Make sure you receive those cards and documents in a timely manner. Not receiving cards and documents in a timely manner can be an indication of insurance fraud. If you suspect insurance fraud in any way, you do not hesitate to contact the Maryland Insurance Administration. Again, use caution with unsolicited contacts. If you are dealing with an insurance producer, so the broker or the agent, and you don't trust and you wonder if they're licensed, you can contact us to find out if they're licensed. In normal times, they need to maintain proof of being licensed and you can ask to see it, but you're probably not interacting with somebody face-to-face right now. And always remember to keep and review your insurance documents and understand your insurance. And so now I'm going to open it up to questions. The slide. Sorry about this slide. I got a new version of PowerPoint. So I'm going to open it up to questions. As I said earlier, if you want to type in your questions in that chat window, please do. And then if not, I'm going to go ahead and unmute the participants' lines. We'll see how that goes. It worked for us a couple of days ago. And if you have questions, feel free to ask.
There's something that I'd like to share. I don't see any questions coming in yet. But one is that because of COVID, some people are thinking that their local office may be closed. And that might be some limited hours in local shift plans. You can still receive services. So we encourage you to contact the phone number and speak with them directly to see how you can receive benefits because they're still available.
Thanks, Rebecca. I unmuted everyone, but if you don't have anything to contribute, feel free to mute yourself. But if any of the 10 attendees have any questions, feel free to ask now that you are not muted. All right, seeing that I haven't had any questions yet, I'm going to go ahead and answer a question that I receive a lot. And that is, can I file a complaint with the Maryland Insurance Administration against my Medicare product, so against my Medicare policy? And that gets a little complicated, so I'm going to try to explain it in a really simple way. So the Maryland Insurance Administration make sure that insurance companies follow the laws. And so Medicare Parts A and B, it's not an insurance company in that traditional sense. It's a program run by the federal government. And so if you have problems with Medicare's Part A and B, as well as Medicare Part D and the Medicare Advantage plans, you take those problems to the Centers for Medicare and Medicaid, or 1-800-Medicare. You take those issues to SHIP, or you take those issues to Medicare itself. With regards to the Maryland Insurance Administration and Medicare, if you have a problem with a Medicare supplement, you can file a complaint with us. So we fully regulate the Medicare supplements. Any other questions from the attendees, or does anyone from the Western Maryland SHIPs want to say anything? All right.
Good morning. I have a question.
Oh. Yes.
You ready?
Yeah, go ahead.
All right, I'm Leo.
Hi, Leo.
we want to be sure we're following the right thinking. When we first signed up for supplemental insurance, we were told that they can't ask you about anything pre-existing; you're automatically covered. But if now it's been a few years and you investigate other plans, and you want to change your plan, are you now subject to being questioned about pre-existing, or are you automatically covered? What's the rule in that sense these days?
Okay, I can take it since I'm the one who's not muted. Okay, Leo, so most likely in the situation that you're in, so right now you've had your Medicare supplement for a while and you're thinking about switching to another company or another letter, you almost certainly will be underwritten unless there's some kind of exception where you get another guarantee issue period. And in those situations, it's usually a plan has left the area or something like that. If you don't qualify for one of these exceptions, then you can be underwritten, and you will be underwritten essentially when you start shopping again for another Medicare supplement plan. Does anybody from the ship want to talk? Say anything else?
That's what I would say. Yes.
Okay. Yeah. Did you have any other questions about that, Leo?
That's it. Thank you.
Okay. Yeah, you're welcome. All right. Well,
I want to add, someone asked this question the other day, and I thought it was a good question that people don't necessarily know about. So there may be a loved one, a family member that you may be working with, and they're not able to call on their own. With their permission, you can call on behalf of a family member to the SHIP office to get assistance with the counseling.
Thanks, Rebecca. All right, well, if there are no other questions, then I will say thank you all very much for your attendance. I guess I'll let Rebecca have the word, but thank you.
Yes, thank you everyone for joining us. So we look forward to working with you in the future.